Welcome, everyone. For anyone who's listening in, we are talking about the project Outbreaks Near Me. We are heading into the winter very soon here. And so for anyone who's worried about getting sick or having some respiratory illness or whatnot, this is one of those projects where we talk about human health. So we're excited to have with us Autumn. And I'm going to go ahead and drop my screen share so that we can hear from Autumn. Do you want to introduce yourself?
Yeah, thank you. Hello, everyone. I am Autumn Gertz. I am a senior project manager at the Computational Epidemiology Lab at Boston Children's Hospital, and we'll sort of get into what that means. My background is in microbiology and public health, so infectious disease is really the intersection of that, as well as epidemiology. So I have experience with infectious disease surveillance and epidemiological research, which sort of combines a lot of the interest and also a really good intersection for citizen science. Fun fact is that I was a citizen scientist when I was a kid. I was always participating in things where I could, and that just sort of continued into adulthood and into my career.
That's awesome. Wait, what citizen science project did you do?
Yeah, so my mom actually works for the Massachusetts Audubon Society, so there was a lot of like birdathons and those types of things, and sort of monitoring wildlife and observations. I think were most of them are the ones I at least remember the best. So.
Awesome. I'm so glad to have a seasoned citizen scientist on board for this.
And then I contribute to our projects as well. So Outbreaks Near Me is one of our team's projects, the Computational Epidemiology Lab. We'll talk about the lab generally, and then we'll sort of dive into Outbreaks Near Me. You're welcome to visit our website, compepi.org. We also just newly launched an Instagram, if anyone wants to follow that. And then we have Twitter and Facebook, which are under Health Map, which is our flagship project. So the goals of the Computational Epidemiology Lab is to develop and use technology platforms and novel data sets to support and inform patterns of disease, promote public health, and contribute to infectious disease surveillance efforts. Now, what does all of that mean? So epidemiology, I think people are a little more familiar with now. I do kind of miss the days where no one knew what that was. It would ask me if that meant I was a skin doctor or professional. But for those of you who are not as familiar with epidemiology, it's the study of the spread and patterns of disease. And there's a variety of different types of epidemiology. You can have topical epi, like infectious disease, or you can have sort of methods-based epidemiology, which is where computational comes in. That computational epi really means looking at emerging technologies, novel approaches, new ways to think about things, and new ways to inform on the spread and patterns of disease. So our team has a variety of technology tools and platforms that we've actually built ourselves, we've coded, or we've taken over from other groups, and these tools are used to inform patterns of disease, promote public health, or support infectious disease surveillance efforts. Outbreaks Near Me really is the last one in supporting infectious disease surveillance efforts, but some of our other projects, one of the ones people are most familiar with, vaccines.gov, that's more of promoting public health and a resource for folks if they're looking for vaccines in their area. Outbreaks Near Me was formerly Flu Near You, which was launched in 2012. So if you've heard of Flu Near You, this is the same group, same project. And the team consists of researchers, epidemiologists, physicians, data scientists, and software engineers. So a really fun conglomeration of folks interested in health, folks interested in the intersection of health and technology, and those sort of focused on technology. Then what is Outbreaks Near Me, sort of within the lab's work? So Outbreaks Near Me is a participatory syndromic surveillance system. What does that mean? So participatory means it's folks like you and I contributing. They're citizen scientists, they're volunteers, they're telling us how they feel. So that's the participatory piece. Syndromic surveillance means we're surveying how people are feeling. What symptoms are they experiencing? So if they're feeling sick, do they have a sore throat? Do they have a cough? Are they vomiting? Do they have rash? Do they have fatigue? And using that to map and analyze different definitions of illnesses. So we have influenza-like illness, COVID-like illness, or seeing if there's something new, if we're seeing an uptick in a strange combination of symptoms we wouldn't usually see. Right now, the site is very focused on respiratory disease like flu, COVID-19, and RSV, or respiratory syncytial virus. We do collect symptoms on a broader variety, symptom data on a broader variety of illnesses. So we have whole body symptoms, GI symptoms, things like headache, dizziness, but the site really works at its core and is really fine-tuned for respiratory illnesses. So novel surveillance systems. So again, sort of this new approach, this innovative way to look at surveillance systems like Outbreaks Near Me are designed to complement existing surveillance. They do this by providing real-time estimates, detecting non-care seeking cases that might be missed by traditional public health surveillance. So if we think pre-COVID, we think back to flu, you wake up one day, you're not feeling well, you have a cough, you have a sore throat, you have a fever, you're like, oh, I think I have the flu, but I'm just going to lay on my couch for a couple days, drink some fluids, be back on my feet. Maybe you take a fever reducer or anti-inflammatory like Advil if you're not feeling great, but that's how most of us would cope with something like that. And then therefore those cases aren't detected in traditional surveillance as flu cases, because in order to be picked up as a marked influenza case in a city or state or federal flu surveillance system, you need to have an interaction with a healthcare provider where an official diagnosis of flu gets entered in to the database. Now we think to the early days of COVID, where there weren't tests available, people didn't know what was going on. There's probably a lot of folks who had undiagnosed COVID. They might have assumed it was COVID or not. Then sort of in the middle of the COVID-19 pandemic, we had pretty good capture of COVID cases. Most folks were getting tested if they wanted to sort of provide a positive test to get access to COVID pay or be able to get the sick time they needed from work, until the introduction of at-home testing, which has been a great tool for individually managing COVID-19 cases, but has sort of introduced this new phase of infectious disease epidemiology, and particularly where we sit, participatory surveillance, where we are able to capture data of at-home testing, that folks they're at home testing themselves, they know they're positive, but then they know how to manage on their own and they're not reporting that anywhere. And suddenly we're seeing less COVID detected through traditional surveillance mechanisms, even if we know more is circulating. So directing you to this little pyramid here, this is a disease burden pyramid for flu put out by the CDC that our data helps contribute to. So you can see at the bottom of this pyramid, we have folks that are infected but asymptomatic, meaning you're infected with the disease, but you're not experiencing symptoms, but you might be able to spread it to others. Then we have symptomatic self-care. That's where most of us fall. I'm not feeling great. I'm going to stay home. I'm going to take care of myself and let this bug work its way through me. But these are the cases that are not detected by traditional surveillance. So this is where we're missing. You can see they're the biggest parts of the pyramid. They're the majority of cases we see with respiratory illness, and yet they're not being detected. And this is where our data is really helpful to folks like the CDC modeling team for flu and for COVID, because we are able to pick up some of those cases, primarily from individuals saying they're not feeling well, not seeking care. But then we are also able to help them attune their models. Within our population, we're seeing that 1/4 of folks who don't feel well with flu-like illness are not seeking care. We can use that model and sort of extrapolate it out or build it out and apply that sort of nationally, and saying that we suspect between 1/3 and 1/4 of individuals who have flu are not seeking care. And therefore, the burden of flu might be 1/4 to 1/3 higher than what we're projecting it out to be. And this data is also used by other research teams, state and local health departments, as well as the CDC. So my citizen scientists here hopefully don't have to ask too much of why you should participate. But I think the big message here, and a lot of us have learned this over the past few years, is early detection and early response are key to preventing the spread of any disease. If we can see in real time that there are increased amounts of COVID, flu, or even just increased amounts of symptoms going around, it gives public health professionals time to put response in place, but it also gives you as the individual reporting in and being able to see on the site, on our map and on other things, oh, there's a lot of illness in my area. Maybe I'll wear a mask when I go to this indoor event I have next week, or maybe I'll test myself before I go see my grandparents for Thanksgiving, things like that. And then self-reporting symptoms in real time can complement traditional tracking and while providing that useful information directly back to you. So it's sort of this bi-directional sharing of data. You're helping us, you're helping other research teams, you're helping your state and local health departments as well as federal agencies, but you can also use that data to help protect yourself and your households and your family and make informed decisions about your health. And who should participate? Everyone. We're always excited to have new participants join our site, and all of you are encouraged to join. We do want our data to better represent what's occurring in your communities and in the US broadly. And for that, we're thrilled for any new volunteers, but we do sort of have a population that skews not as representative as the entire US, and therefore sometimes it's hard to generalize our data. So if you or you have any friends or family members who are younger, male, live in rural areas, or have racial or ethnic diversity that is not white and not non-Hispanic, that's sort of a population or a few populations of folks we're really looking to have more participation from. But that is definitely not to say that if you don't fall into those categories, we don't want your data. We absolutely want your data, and we want Outbreaks Near Me to be useful to you to make decisions about your health. So how to participate, you can visit outbreaksnearme.org. You have a couple options. When you get to the site, you can create an account with your name, your email, and a password and submit your first health report. And hopefully you're feeling well. Once you're in, you can also sign up for text message reporting if you would prefer to be reminded weekly via text and be able to text a short code instead of via email. But you can also submit a report anytime without an account. So if you just want to try it out, you can go submit it on the website. We prefer you have an account. That way you'll get those weekly reminders. We have a little bit more information on you, and we can get in contact with you more, and you can get our awesome newsletter and other things. But we do understand that's not the right path for everyone. So we'd rather have you submit your data in a way that makes you comfortable than not submit it at all. And when to report, as I mentioned, we do have our weekly reminders that are sent out via email or text. You can select whichever one you prefer. And you can also report on household member health. So anyone living within your household, you can add to your account and report on how they're feeling since you're privy to that. And that helps us gather a wider variety of populations, but it also helps us understand things like household transmission of infectious diseases.
I'll jump in here briefly for a second here, but even so if you do have an account on Outbreaks Near Me, it's even better because you can go to SciStarter. Since it's an affiliate project, you can actually connect those accounts so you can get a tracker of all your contributions over time. And that's super awesome for anyone who's looking for volunteer credit to show off how much they've been doing for citizen science, and also just to see how often you participate in projects like this. We have campaigns that happen every once in a while that are for citizen scientists to show off just how much effort we can do. And so times like coming up in 5 months or so, Citizen Science Month in April, we want to make sure we can show off just how much citizen science goes on around the world. So if you are able to have an account on SciStarter as well, you can go to the page for Outbreaks Near Me on SciStarter, that link right there. Click the visit button to add it to your dashboard, and you just need to make sure that your email addresses are the same for both accounts. So as long as it's the same between the Outbreaks Near Me account and your SciStarter account, you can set those up to be affiliated, and then you confirm you've joined on your dashboard. So your SciStarter dashboard will probably have it as like visited, interested, and you could just click to confirm that you've joined, and then boom, it tracks all of your contributions. So we'll know how often you participate in that one, and we can give you better advice on what to do next too. So super easy to combine the both so we can make sure you have the highest impact possible when you do all this great work. Awesome.
Great. Another moment you've been waiting for. Let's try it. Let's see what it looks like when you submit on Outbreaks Near Me. So give me a second to just pull up.
I was curious while you're pulling that up. I'm just thinking through questions of things that would be nice to look at or to get your opinion on. I'm curious to hear like examples of how organizations like the CDC and like the like any other groups might have been using it to track during COVID, or what's the new goal now that we're kind of out of the pandemic? What's the ongoing plan, I guess?
Yeah, so, Outbreaks Near Me started as Flu Near You. So flu was really our bread and butter pre-COVID. We were very well situated to jump in and help track COVID-19 when it emerged. As we're sort of moving to this post-pandemic world, we're now attuned for 2 respiratory illnesses. We saw a lot of RSV last year, a lot of concerns around that. So we're seeing how we do with that. So our sort of long-term goal is just continue being participatory syndromic surveillance for respiratory disease. Flu has its own season. COVID, we're trying to see if there's some seasonality there. There's always potential for a new or known infectious disease and respiratory disease to have an outbreak. So we're really there to track it, as well as sort of seeing if there's capabilities for us to track other illnesses like a GI outbreak. As far as how this data was used during the pandemic, a wide variety of ways. I can give a few examples. One of them was when at-home testing for COVID-19 emerged. We actually helped a lot of state health departments adjust their burden estimates of COVID-19 so they could scale them up by a factor we helped calculate based on our data on how many at-home tests were being reported and how many of those individuals reported telling someone like a provider or health department that they had a positive test versus not. And we found that most states were vastly underestimating the amount of COVID they had, which was then informing their guidelines. So without the sort of proper knowledge of how much disease there was, you assume there's less, you ease up guidelines, even though there's more going around. So that's one way. More recently, our data has been used. The other way traditionally is sort of helping figure out how many cases are seeking care versus not. Some of the more like interesting, I guess, or different uses of our data throughout COVID were a couple of research papers. We looked at mask wearing and actual transmission of COVID-19 and found that folks that reported wearing masks sometimes and often went much longer without getting COVID-19 infection versus folks who didn't. That may seem obvious to us now, but at the time, it was sort of the first empirical or observed evidence that was the case. We looked at how many people were delaying healthcare during the pandemic and what populations that was, and found that between 2020 and 2021, it was a lot of the folks who would be at the highest risk of severe COVID who were delaying healthcare, probably to not get exposed in a healthcare facility, but that's also not great if you have a pre-existing condition where you need to be seeking healthcare. So those are some interesting ways that the data has been used as well. So I will mention here, don't be afraid of these small numbers and the map not looking as pretty. This is, as I mentioned earlier, before folks join, this is our staging website. So all of the data I'm submitting won't be skewing our actual results, but this should give you a good idea of what the site looks like. So you join here, you can see I'm logged in and I can report my household health. But down here is our map, which usually will be filled with data, and I can pull up our actual site and sort of show you what the real map looks like as well. And then we have some resources located at the bottom that I can go through as well on the real site. But we're ready to support our household health. You can see here, I have a couple household members that I'm reporting on, Test and Test 2. So we're going to say I'm feeling well today, but Test is not feeling well. And we're going to skip Test 2 because Test 2 is away at college and I don't know how they're feeling at this moment. So here you'll see we're asking about vaccination status. Did these household members get a flu vaccine on or after July 1? We'll say this one is yes, this one no, and they're not planning to. And then similarly, did these members of your household get a COVID-19 vaccine on or after September 1st? So that's sort of our most recent COVID-19 booster. And you'll see here, we have race and ethnicity data that we would like to collect on participants. If you're wondering why we collect these data, if it feels too personal or something, this is how we know if we're accurately representing your community. With these data, we can see sort of who's reporting in, who's not, and seek out recruitment from certain populations to make sure we're capturing that data, especially if it's populations that are traditionally under captured in research. We want to make sure we know how disease is impacting them. So we're sorry to hear that test is not feeling well. This is where we collect what symptoms they're feeling. So fever, and we're going to say they had a 102 fever, cough, loss or change of smell, sore throat, and then we will say fatigue as well. So this meets our definition for COVID-like illness as well as influenza-like illness. It'll ask when they started feeling ill. We'll say yesterday. And then this is where we find out who's seeking care, who's not. So you can say didn't seek care and move on. Or we can say they actually did some at-home testing. So what type of medical test? They did an at-home COVID test and an at-home influenza test. They did not do a follow-up to their COVID test. And we're going to say that they were COVID-19 positive and they haven't received any prescriptions. And then I, as the healthy household member, it's going to ask me if I've been tested for anything in the past 30 days. I'm going to say I took a home COVID test because I was concerned about being exposed to COVID because, as we know, test is in my household and has COVID, but for now I'm negative. And that is how you submit a report that goes in. That data will show up on the map. So I think my zip code is over here in Boston. So you can see this little sick dot now. That is test data. And you can see there's a couple of symptoms. As we're located in Boston, a lot of our test data is Boston zip codes. But that's sort of what the development site looks like. And then I will pull up our actual site to show you the map with real data on it, which is much more exciting than the staged one.
That's awesome. I didn't realize that you could put other household people on there. So I have my account on the side.
Yeah.
Just to make sure
If you go to account settings, you should be able to see it in there. So here's our official map. You can play with these. So this pink is COVID-19 symptoms, flu is orange. See that. Other is people who report not feeling well, but they're not meeting the definition for COVID-like illness or flu-like illness. And then the majority of our respondents are those folks who are feeling well. And that data is still really important for us to capture, even if it might not feel the most interesting, because that one keeps you engaged as a citizen scientist, even when you're not feeling well, which is hopefully most of the time you're feeling healthy. But it also allows us to sort of look at the relative rates and measures of disease compared to the overall population. And then we can also look at the government reported data. So how is our COVID-19 data comparing to official data? Are we seeing clusters in the same areas that are dark here? Or you can turn that off if you don't want to see it. You can also look at flu data by state and see if flu symptoms are lining up with that, and sort of see how the government data versus our individual participant reported data is performing. You can also type in your zip code and it'll zoom in for you to where you are, and you can see someone near me is not feeling well. Not great to see that, and then zoom back out.
I'm very curious how my area is doing.
Yeah. And then something we recently relaunched that we had with Flu Near You is our flu trends page. And what this page does is it in real time, there's about a week or two lag, but pretty much real time, will show how our data is tracking compared to CDC ILINet, which is sort of the official syndromic surveillance network for CDC. It's not participatory, but it is syndromic. So you can see sort of historically, these have tracked pretty closely together. The 2017-2018 flu season was a pretty severe flu season. You see, we had a little bit of an early warning for that. You can see the end of 2019, there was a big increase in illness in our system that actually drops. And we have a paper under review right now about how our sort of very health-minded population saw a drop in respiratory illness a little bit ahead of the recommended guidelines for COVID-19 in early 2020. The 2020-2021 flu season, there was like no flu circulating. So you can see that here. Then last season, then we see here, there's a little bit of a departure more recently, and that's totally okay. respiratory illness surveillance has really been adjusting with COVID, post-COVID. We're detecting a bunch of different things here. This is not all flu, but this was sort of the flu season peak last year. And then we're seeing in recent weeks increases in flu season. So that's a nice way to see directly sort of how our data in real time is comparing to sort of the closest federal system there is to monitor syndromic flu-like illness.
Yeah, I hadn't even thought about comparing to the CDC's tracking, but that's really cool to see like how aligned it's been over the years. And with the recent one, do you think is the departure from the alignment, is that close to, or is that related to maybe them tracking, you're tracking way, you mentioned to just more symptoms than what they would usually be?
Yeah, that's a great question. So this is just showing our proportion of influenza-like illness. So it is sort of the same definition. However, it is a broad definition. So it's fever plus cough or sore throat. I think we all know you can experience a lot of things that have some of those symptoms that are not the flu. There was a lot of just generalized illness going around in spring of 2022. There's probably some COVID in here, allergies, RSV. So I think this was just really a time where a lot of people were sick, and their data is sort of outpatient and inpatient. So it's more of the folks who are going in and seeking care, and those symptoms are getting picked up. And if you're probably seeking care for those symptoms, it's probably a little more severe. It's probably more likely to be a flu or something versus just sort of generalized respiratory illness that I think we've all probably experienced, where you just don't feel great for a couple days and then you're all set. So.
Well, yeah. Oh, that makes a whole lot of sense then to me to have the household members, because it's a lot of times you just feel sick and it's not necessarily you have to go to the hospital or anything, but your family knows, and your people you live with are trying to prevent themselves from being sick. So being able to show off which people are feeling unwell, even if they're not flu or COVID positive, then that's super helpful. Wow. This is like awesome data. Like awesome data, it's the technical term for that one. I am very excited to see like the changes over time too, just for trends since we've lived through, there was a flu pandemic in the 20s, right? And then now we had COVID. So I'm very curious to see human data over time, over long periods of time, to see what we discover from that. So I'm excited to see all the work being done right now.
Yeah, I think it's an interesting time. People are a little more aware of their health. We have things like at-home testing where folks are a little more empowered and able to sort of manage their own health, which is really interesting. But we want to make sure we're still collecting that data to help inform public health decision-making and disease tracking. So our team is situated well for that. We sort of work in this space well of new and emerging technology and data, and how do we integrate that with existing systems.
Right. Yeah. And you did mention something about the drop in respiratory illness before there was a big increase in illness across the board for the more health-minded. Do you think that it's just a trend of people who are more healthcare minded are the ones submitting these requests? Is usually what that might be.
Yes, our population definitely skews a bit older, a bit more educated, and a bit more health-minded than the general population, which makes sense. They're wanting to contribute to a health citizen science project. We actually saw back in Flu Near You, when it was Flu Near You, not Outbreaks Near Me. It was around February 2020. We had started to see the uptick in flu cases, and that's when the drop started in our system, even though we all probably remember not so fondly, it was really March of 2020 where things started to shut down and change. So sort of seeing that our population started to employ non-pharmaceutical interventions probably earlier than the general population, enough so that we actually observed a decline in illness while sort of everyone was getting COVID, was a really big indicator of the folks who are reporting in.
Yeah, that must have been such an ego boost for all of them too. It's like, haha.
Probably felt vindicated. Yeah. So
yeah, they knew they were doing the right stuff. That's too funny. Now I'm jealous of them though, so I should get everyone on board for this in my family. Be like, you definitely need to do this so you can prevent yourself from getting sick in the next big uptick. Although now we have, or knowing those seasons that are coming, hopefully more people know to do that regardless of having this as a resource. Yeah. This is excellent. I'm excited to see where it takes you, and I'm excited to see how many people we can get to start participating in it over the next couple of months, because I think this is a really good one for just, it's so impactful, and it takes very little time. Being able to just say, yeah, I feel good almost every week in the last like couple of months has been one tally mark of, yep, I did citizen science for today, and it's didn't take that much time. So I bet it would be really great with schools too, like for families coming out of schools, because they've got people in their homes. Do you have any partnerships with schools that have done groups like this before?
We have worked with universities before. You know, a lot of professors who will sometimes introduce this in an epidemiology or public health class. We do sort of find that participation wanes, which makes sense. I think when you're in that phase of life, it's a bit transient. But given that we do the entire US as well as Canada, it's really hard to try and do localized campaigns if we don't have a partner on the ground there, since we're sort of trying to do 2 countries. Sort of partnering with schools isn't as feasible, but usually if a state or local health department wants to promote, or if they're trying to use the data for a certain study, they'll start to get more participation in their area, and that helps increase the signal for their municipality. That's worked very well. So
yeah, I could definitely see I used to live in Arizona, the Arizona Department of Environmental Quality, I think. I'd be curious to hear their thoughts, or if they've worked with Outbreaks Near.
We have worked with Maricopa County a lot.
Oh yeah.
Yeah.
Nice. Good job, Maricopa. Where I lived. Oh, sort of. Yeah. No, that's where I live. That's true. That's a true statement. That's awesome. Amazing. Okay, so we are about 20 minutes from the hour. I think we probably will be able to close out early if that's all right with you. But this has been excellent. I'm excited to use this data just to look at what my area looks like and add all of my family members and force them to create accounts for their own homes, to keep them healthy and knowledgeable about what to do too. So thank you so much for going through all that and showing us the website too.
Yeah, you're welcome. Thank you for having me.
Okay, I'm going to go ahead and share my screen again so you can see the slideshow. If there are any questions, you are more than welcome, anyone who's watching, to send them in to us anytime. You can send them into us now, or you can talk to us via our email, which is on a slide in the future. So I'll share that with you all in a moment here. But just to get you ready for the next area. Oh, and you're very welcome, Kathy from Facebook. Very welcome. Thanks for sharing that, Roland. Our communicator across different methods. On our next SciStarter Live, excuse me, can't speak. We have a sourdough for science conversation. So we did a similar event last year, but this time I'm being told I need to make sourdough and do this project, and I'm very excited. Being told is kind of a weird way to put it. I was excited for it. But especially since we're coming up on Thanksgiving. So if you're interested in learning how to make sourdough in general, and not just for science, but then also learn how to commit all that data before making the sourdough to science, you can join us on November 14th next week to talk about that. I will also have a family member of mine who is a certified cook / chef who works with pastries. So hopefully he can give us a good view of what it's like to make sourdough professionally. And yeah, that'll be fun. So welcome to join us there. We have all of our updates on the blog as well. We have an ongoing campaign with NASA, the Do NASA Science Live event series. If any of you participated in the October annular eclipse, we had a recent event before then called Prepare for the Eclipses. So if you were excited then and are excited again for April, you can go back and watch that one episode about preparing for the eclipses, where Phil Plait, the bad astronomer, was able to tell us more about what the eclipses mean, what the heliophysics big year is, and what's coming up for us this year. So we're excited to have that keep going, and we'll have another event added soon, so you can keep track on Do NASA Science Live, the website for it, which Roland has dropped into the chat, scistar.org/NASA-live for anyone who's listening later. Awesome. And then lastly, you can reach us at any of these methods. So we have our asking the community, asking the project leaders. If you message the project leaders, like on Outbreaks Near Me, you can actually contact the individuals like Autumn here, who can reach out and make sure your questions are answered. info@scistarter.org is sent to, or anyone sending anything to info will go to myself and Roland and a bunch of us who will be able to help you. So feel free to send us a message if you have any trouble. And then we have a podcast, we have trainings, and we have thousands of projects on SciStarter. We really want you to get involved, whether it's for human health, environmental health, whether it's for climate reporting or biodiversity, or just you like going outside and staring at clouds and want to help NASA do something with that, you absolutely can. So go ahead and find your next project on our project finder. Link is right there. And we hope to see you on there more often. If you have any thoughts for us moving forward, we have a post-event survey that you can fill out and you can find in our follow-up email as well. So thank you all for joining us today. We're excited to have you all here. Hopefully you all stay safe and healthy in this season, and we'll see you again next week and any of the weeks after that. Have a wonderful rest of your day. Bye, Facebook.